Well, folks, I'm really very excited to host Dr. Samir Al-Hadidi, who is going to introduce himself in a little bit on Healthcare Unfiltered. I am very much looking forward to meeting Samir in person very soon. We are taping this episode just for context. In early November, it's probably, we will see if it will air before the ASH 2021 meeting or after, but for those of you who are listening, I just want to make sure that you know at least when we are taping this episode. And I can see, goodness, so many diplomas and certificates behind Samir. So you're going to see that when we put that on my YouTube channel, Shadi Nabhan and Healthcare Unfiltered. Samir, welcome to the show. Welcome to Healthcare Unfiltered. I'm very happy to have you on. And I think probably what triggered this is an essay that you wrote in the ASCO post that brought tears to my eyes, and we will talk about this in a little bit. But maybe first and foremost, introduce yourself to listeners, who you are, what you do, where you do it, and whatever you'd like them to know about you.
Thank you so much, Shadi. It's a pleasure and honor to be with you on this lovely podcast that I follow myself, and I really get lots of nice things out of it. I'm Samir Al-Hadidi. I'm recently an assistant professor at the Myeloma Center at the University of Arkansas in Little Rock, Arkansas. I just graduated from fellowship from Baylor in Houston. I used to work as an also assistant professor in medicine for 2 years before I did my fellowship. So I have this transition from faculty to training and back to faculty now again. I do myeloma. I do transplant for my myeloma patients. So it's all about myeloma and plasma cell disorders. I also like healthcare disparities and work on it and try to hopefully get rid of it in the future. So this is one of my focus areas on top of plasma cell disorders. So it's a pleasure to be with you, Shadi, today.
Thank you, Samir. So this is your first faculty job as in hematology oncology, and that's where Bart Barloghi used to be, right?
That's correct. Yeah,
he's retired. Is he retired? He's retired or no?
He retired. Yeah, he moved to New York and retired there. So yeah.
And how big is the myeloma program now at Arkansas? Is it small or big?
Well, it is. I think it's one of the big myeloma programs in the country. I mean, we still have the most, the largest patient data set in the whole world, comprehensive data set, and we still see, a great number of patients. We are a total of 5 clinical faculty that do only clinical with research, and we have a separate research department that is run also by, researchers, basic researchers that we collaborate with and work with. So we have a strong basic research and strong clinical also research with five faculty that just do plasma cell disorders. So also, our setting include myeloma hospitalists and myeloma nurse practitioners that are, important part of the team that help us in inpatient and outpatient and in infusion that runs 7 days a week. So our infusion never closes 365 days a year. So that's really good. Yeah.
And you took a year off after residency to do internal medicine, and then you went back for fellowship. So you transitioned from trainee to attending to trainee to an attending.
That's correct. That's, this is a weird transition, let me call it this way, because, you're done with the training. I was board certified in medicine. I did a master degree in clinical research. So I completed this. It was a 2 years program, and I took a faculty job while I'm done with it. And I did that back in Michigan. And then I moved to Houston to do my fellowship.
Yeah. Well, I've actually done several episodes on myeloma and on the podcast, but we're not going to do myeloma today. We're not going to talk about myeloma. We're going to talk a little bit more of less medicine and really more about the personal aspect of practicing medicine and the challenges that you went through. So how long you been in the U.S.? You're originally from Jordan.
That's correct. Yeah. So I came here. I did 3 years of residency, 2 years of faculty, and another 3 years of fellowship. So this is a total of 8 years. This is my 9th year in the US.
Okay. So you came 9 years ago to the US. And Gosh, Samer, I'm pretty old. I don't want to tell you how long I've been here. But what I want to start talking about, Samer, is an unfortunate illness that you were diagnosed with while in training. Now, you did your residency where?
In Michigan.
In Michigan. So take us through this. How were you diagnosed? What were you diagnosed with? What happened to lead to this diagnosis? And what year were you in? Just take us through the process. I know some of this may be uncomfortable going back in memory lane, but you will see what I'm driving at. I just want to know, get context into when this happened.
Yeah, and I think that may be important. Some trainees may have similar things that they went through. When I was in residency, it was the third year of residency when things got bad to a degree that I needed to take care of. I knew there was something wrong for a while, and I think going back to my memory, it seems that I have those episodes related to Crohn's disease back when I was in my teenager years. I didn't think I realized that I have that at that time. It was self-limiting and nothing, major complication happened at that time. So it went through fine. And up until I was in residency, third year residency, it got so bad. And the way it Crohn's, especially in me, I mean, it could have been in a different way, but I have some skin, disease, which is the erythema nodosum that happens with Crohn's. And that was up to a degree that, limited my ability to do my, rounds in a good way. So I was forced to take care of it. And the reason why I think part of it, me ignoring to do something about it, was my worry that I'll get late into getting into my next step in training and, and fellowship and so on. Because when you come on a visa, it's very difficult to take a break. And if you take a break, maybe things will not go the way you want to do it. So at that time, it took me some courage to go and, go to a primary care who was one of my attendings and while in training. And I told him, I have Crohn's disease, but we need to diagnose this. And you need to refer me to somebody to do a colonoscopy. And he did. I mean, I went to a GI who, he did a colonoscopy for me and actually saw me after the colonoscopy. Believe it or not, I think the way some of the GI physicians practices is procedure-wise. So he saw me after the fact that he did the colonoscopy, and he told me, I think you have, maybe Crohn's, but maybe we need to rule out other stuff because you're coming from Jordan. And he was worried about, all those endemic infectious diseases like TB or so on. We worked this out, and then I thought that I need to see somebody, more experienced, and I went to the University of Michigan and saw a really nice physician there that took care of me while I was in Michigan, and I took this, I would say, disease under some control initially.
So how, like from the time you started having symptoms until you decided to seek medical advice or care, how long did it take you to decide, I'm going to go ask somebody what's going on?
I think it was a few months, and I think that the exact number, I don't remember it, but it was so bad to the degree that I really have an advanced skin manifestation of Crohn's. And I think that it even made it difficult for the GI to believe that this is all Crohn's, because, I was ignorant to the fact that I need to go and do something about it. And part of it was I need not to delay what I'm going through, because, being in a visa is a special circumstance. I think anybody can relate to if you're coming to the US on a training visa, because it's kind of difficult to take a break. Even if it is for your medical health condition. You could have taken it. Programs are good enough to give you some time off if you request the time off. And I don't think this is the biggest problem. The big problem is when you take a time off, all the deadlines for what's coming next will be, it will be away. And then you have to go off track and maybe lose some years, and you don't know if you could stay even in the US if you do that, because if you're not on a job or in training, your visa will not be renewed. So I think that has to do with it being part of me and thinking that, I need to keep going. So I need to get rid of this training and get done with the training. So I could have, take a break. But at some point, with my wife also being supportive for me to do this, I think we made a decision that I need to take care of it. I probably should have been doing that like earlier, to be honest, but it has many reasons that I thought pushed me not to do it.
And at the time, so you were married at the time, and did you have children at the time?
We have our oldest girl at that time. I mean, my wife also was in pediatrics residency, and so what made it hard, because you have this, there's a daughter in between, goes to daycare, and there's 2 trainees in a house, and this is very difficult to take some time off. Ultimately, I was able to do it, and I think that my program was really supportive at that time, and I took some time off. But I thought I could have been doing it earlier, and I should have been doing it earlier.
But there's a sense of fear that immigrant physicians probably have more than others, that if we really do this and take time off, it's going to lead to a cascade of events.
Yeah, and it could have changed all your path that you think about. And like I could have not even been doing my oncology fellowship. Who knows? Because if, let's say that you're doing training and something happened that delayed your graduation for 2 or 3 months, so technically you cannot apply for a fellowship, and moreover, even you cannot apply for a job on a visa, because if you want to apply for a job, you need to apply early on to get your job, to secure your visa application and sponsorship. So it's either way. It's not only going to another training, it's doing any kind of job or staying even in the US to, it will be problematic if anything happens. And then I think that's why probably, I mean, many friends of mine went through something similar, and I decided to keep going, because otherwise they may miss, the train and get in trouble, not themselves only, also their families.
Yeah. So then you were diagnosed with Crohn's, Samer. Was it, did you require hospitalization? Was it mainly outpatient therapy? Was it?
So initially it was mainly outpatient. I mean, I think I was crazy enough even to do my colonoscopy after I rounded on patients in the morning. I think I would say something in me that make me work to the last limit. And at that time I was keeping all things as an outpatient, even like when I had this, I would say, bad manifestation when I first was diagnosed. But afterwards, because I started a biologic, and the first biologic did not work with me, and at that time when I was in fellowship, it just I got admitted because.
So, but what happened between residency and fellowship? You were doing okay, like you had no issues with Crohn's?
So initially, when I was in the first biologic, it took care of some of my, I would say, symptoms. And I never thought that everything should be under control, to be honest. I thought, it takes the edge of it. Maybe, my skin disease was much better. My GI symptoms got better, but I had some days where I had some problems. But I kept going, and it was fine. Early in fellowship, I started to have, worsening of my symptoms, but up into November of the first year, at that time, I got admitted actually for the first time with Crohn's exacerbation. That was bad enough. I stayed probably around a week in the hospital, did some procedures, and after that, all my medications was changed, and so far things are good.
What, when you were hospitalized as a fellow, were you a little bit more comfortable, missing some work and things like that? Were you just psychologically not there?
Well, I was, and I think I really have a supportive fellowship program, but I think I had my green card by that time, because I got that switched when I did my first faculty job, and I felt, even if I got delayed in my training, nothing bad will happen, because I could have stayed. I can stay with my family, and I could have stayed legally with my family and with no problem, and I kept I can keep my job going with no problem. I mean, I didn't stay off for a while, for a long time. It was probably a week or two. And then I got back to work slowly and then back to full speed. But at least I got a few days off while in the hospital and to recover after it. And I think if I was, I mean, on a visa, I may think twice about it because that could have affected me differently. But I mean, I graduated that time, and if things went smoothly, the fellowship program was really supportive, as well as my training program before. But I think my situation was different in a way that, you know, I am on green card now, which makes it easier in a way that I could have made decisions differently.
And it's you probably speak the language of a lot of immigrants who obviously are wanting to be in the United States. It's a land of opportunity, and it allows a lot of people to achieve dreams that otherwise they can't really achieve locally where they are from. And it's amazing how much we are willing to sacrifice and compromise to achieve that dream, isn't it?
That's right. That's totally right. And, you know, I feel it now with my wife because, you know, believe it or not, I am on a green card, but she's still on a J1 waiver process that she's going through now. And I feel the pain, you know, because any decisions she need to be, you know, in the dimensions of what the visa allows and don't allow. And, you know, I remember one of my friends back in residency who unfortunately his father died while he was in residency. He was not able to go to see back to home because his visa expired, and if he goes back he had no guarantee that he will get another visa to come back to complete his training. And you know, he had this promise with his dad before he died that he's going there for a reason, and I think initially he had some problems getting his visa, so he didn't go. I mean, it was hard on him. I mean,
he's not alone. I'm 100% sure there are many immigrants that have that. And you actually, you know, it took you a long time until you saw your own parents, right? I mean, how long were you away without seeing your parents?
Well, it goes for a few years each time, and it depends how much risk you want to take it. You know, you go for a year or two and you say you will not go to see them. And then at some point you say, okay, I'll take the risk. I'll go back to, I mean, I'm from Jordan, so I go back to Jordan. I'll get a visa appointment the next day when I go there and hope for the best. I mean, some people may get their visa under administration processing if that may take them time. And you know, I remember this time when I went to the embassy, and you know, the lady there asked me, you know, where do you live? I said, you know, I used to live in Michigan, so I live in Michigan. She said, oh, I mean like here. I said, no, yesterday I was in Michigan. Today I'm here to just renew my visa because I'm here for a vacation and then I'll go back. So it's real, you know. I think we do our schedules, our vacation schedules to be good enough to go for those embassy visits to renew the visa. And many of my friends, the people I know, may not take this risk because, you know, there is risk to it, risk of delay, risk of...
I didn't. I was in your shoes and I did not actually take that risk. For 9 years, I did not go. But I was fortunate that my parents came twice during those 9 years. That's it, really. But it's, you're right. I totally can relate to that. But then COVID-19 hit, and even if you wanted to go, you couldn't go, right? I mean,
yeah, and up till now, you know, we are vaccinated now. Things are getting better overall. But for now, like, for example, many embassies are closed. So if you're on a visa and you want to go back to see your family, you cannot even go because the embassy is closed. So you cannot renew your visa. Yeah. And so it's a trouble that we deal with now for like up until this moment. Our embassy in Jordan is closed. So the US embassy in Jordan. So if you're from there and you want to go back home, you cannot do that just because, you know, you cannot renew your visa. So that adds to the, you know, the all issues that we deal with COVID and all the stress that is related to COVID. I mean, also my own stress now, having, you know, this immunosuppressive condition and being on immunosuppressant, and this COVID hit and nobody know what's COVID, and everybody got scared, and I got scared, and I think, you know, even my program got scared, and I think it just, you know, all of that was a stressful time.
And then and then you made a decision to go and visit your family. When was that? Recently, like in 2021, right?
No, that was actually 2 years ago when I went at first. So you know what?
So that was before. That was before the COVID.
Just before COVID, yeah. So at that time, you know, I mean, I got over my exacerbation. Things got better by the beginning of the year, and we thought, you know, we had this time off, me and my wife. So we got a vacation for 2 weeks to go to Jordan, and at that time we have 2 girls with us, so we're all excited to go to visit, and we really enjoyed the first few days there. You know, everything was okay, but then you know, my father got sick and unfortunately passed away when we went there, and that was unexpected. It happened, and I think it made me change my way. I look at the things, but I was in a way thankful that I was able to see him before he died.
Yeah, I'm really sorry. This was tragic, and you wrote about this in the essay that really caught my attention, because it was just I could just totally feel how you wrote it. And I know probably asking some of these questions will bring a lot of emotional aspects, but I really think it's important because, and I'll tell you what I'm trying to get at, and you correct me from reading the essay, but it's always easy, I think, us as oncologists or hematologists, when we are, not easy, easier, when we are discussing end-of-life issues with people that are not our relatives, right? We're very empathetic. We obviously realize how devastating things are, but still, it's not your father, it's not your mother, it's just different. So that they don't have that relationship. But you faced something unbelievable. I mean, I could only imagine. I know that, so your dad had a hemorrhagic stroke suddenly. You woke up in the morning, according to the essay, and your dad wasn't able to talk. And then you go to the hospital and you're faced with some decisions into what to do next. As much as I hate bringing memories that are bad, but I really want to, I can't only imagine, how do you really deal with this? How do you make a decision suddenly, just happened overnight, everything was fine for 2 days, overnight, and you have to decide, do nothing or do everything? What happened?
Well, I think it's very hard, and it's as you said, it's something. It was like a dream. You know, you wake up in the morning, you find this medical scenario that you deal with your own dad, and you got to know. I'm an internist before I was an oncologist, and I got to know that there's a stroke there, and my father had some comorbidities. He had heart disease. It was under control for years. And he's in good health, otherwise. His blood pressure is controlled. He takes all the good medications that are out there. And he follows with his cardiologist regularly. And I think he does his part. So you get to see that this is a stroke and you're in a vacation. And my mom, bless her heart, people are not into medicine. So she could not know probably what that means. Being sick is something, and being so sick is another thing, and being sick to a degree that you will die in a few minutes is another thing. And I think that is one of the burdens that we physicians deal with, is that you're ahead of the curve. You know more about a given condition than the regular people, and that's good and bad. And I think when it comes to you and your personal life, it's kind of bad, because you cannot hope. You don't know. There is there is really a privilege of unknowing, and the privilege of unknowing is that you may have some hope that something good will happen. So we really have good Naim at that time, and we went there, and it's just start as an episodes of things. Initially, I thought, this is a stroke, and I felt so bad because I thought this stroke is bad to limit my dad ability to do stuff. And he never retired. My dad was in the retirement age, but he didn't like to retire. He continued to work. His workload was not as high as before, but he used to go to work every day, and he takes only 1 week off in 1 day off in a week. That's what he used to do, and he goes to work early on. He does his things, and he go back. So for him, being active and being, I would say, able to take care of himself, in our words, is really a priority. So I thought in my mind, driving him to the hospital, that, oh God, this is a stroke, and he may not be able to walk for a while, and maybe he's not able to speak at a while. So that's why my initial thinking, I was thinking, what, this is still something reversible, but he will deal with some consequences. So we went there, and he was in the window. It was like less than 3 hours, and I thought, what, this is good. He could get something to reverse this. He's in the window to get this thrombolytics. And we got him to get it. We got also an interventional neurologist who we were lucky to have him around in the hospital to do an intervention on top of the thrombolytics, which we learn in books that this is probably the best chance for people with ischemic stroke to deal with. And we did both of those, and we, things looked very good, but complications happened after that, and he was not awake for a while, a few hours. And then we got him a repeat scan, and that his stroke turned to be more hemorrhagic. And unfortunately, we're forced into a degree of decision that we need to decide as a family. And as a family, meaning me and my mom and my sister. So, I tried first, I'm an oncologist, so I believe miracles could happen, and I really pushed for it. So I tried, I got him a neurosurgeon. He wanted to do some, intervention for him initially, but things did not last long. And I think that the timeline was not in our favor. So it gotta be what it gotta be. I thought, and best of his interest, if he's alive, he want to be functional. And I think, regardless of what we did, we decided just to let it go for his sake and for our, for what he really wants. And I don't think we could have done something different, but it just, the whole process was so short, to come up with conclusion or even to think about it. And I think after the fact, we talk about it, and I think it's that we didn't have time to think about it.
Wow. What made you decide to write about this?
Well, I used to write even before I went to medicine. I'm somebody who tried to, I used to write in Arabic before, and used to have my own column that I always write on every week. Then I went to medicine, and I think everything changed. But whenever something happened in my life, I just write, and I write and keep it for a while. And sometimes, I wrote that some time after that happened, not long time, but I kept it with me for a while before I decided to send it somewhere to get it published. And I think I did that just to try to share with people that, where even like I'm as an oncologist, as you said, we make many decisions to change code statuses for patients, to stop doing what we're doing. And, we talk to families, we do all those family meetings, but we as ourselves have those difficult times when we go through this ourselves, and it's not never easier on us just because we do it and we know how to do it.
But did something happen that triggered you to submit this a couple of years after the event? Or just you? I'm just curious because you said you wrote it a couple of years before, but then I just read it now. Did something happen, or you just said, you know what, I'm going to see if others, I want to make sure I share the experience?
Oh, actually, we're blessed to have our baby boy. It's now almost 6 weeks, and I think that
Oh,
that
congratulations.
thank you.
Hey, you don't look like you're being up at night. I don't know. Well, hey.
Oh, that's another thing. You're chronically sleep deprived, so
I know you're looking good. I know, I'm not seeing this. We need to talk about that. But yeah.
yeah, I mean, he's a good boy. He sleeps sometimes, not every day, but yeah.
So was that the event that made you decide you want to share the experience?
Yeah, and I think, I mean, I was waiting to get to, I mean, it's not waiting per se by waiting, but I felt this is the thing that should have mean me do it and send it at that time.
Um, Samir, these experiences sometimes, I don't know, and I don't want to put words in your mouth, but I mean, I'm like you, I'm an immigrant as well, and it just makes you wonder how difficult it is to live that far away from family, right? I mean, it's not like you really can really take an hour flight or like drive for 2 hours and you're right there. It's 24-hour endeavor if you can get on the next flight and if they have a seat and all of that stuff. Did you ever go back and look and you questioned your decision about being here?
I did. I mean, I many times I think about it, and I think, you know what, life is short. Why should we take it the hard way? And I think you're totally right. Even if I decide to go to see my mom, for example, in Jordan now, it will take me, if I decide now and I will go to the next flight, it will take me a few days to go there. And now with COVID, that may be even harder. So it's a trouble. I mean, I'm blessed enough that my mom was able to visit me last year, and she went back, so I was able to see her. But it's never the same, because if you have a vacation or you have some time off or a holiday off, you could have just go and see your family, or, at some point if you decide to do that. But I think for us, it's not as straightforward as this. There's many things that play a role on there. Like even for me now, if I want to go, let's say I want to go back to Jordan to visit my family, my wife needs to renew her visa, so I have to put this in my calculations and see if that is possible or not.
Or you have to go on your own and she stays here.
Yeah, and I did it. And I mean, last time when I went for a week to see my mom. I went by myself, and I left my family here just because there is no way around it.
Yeah.
And so,
But
unfortunately, those decisions
did you like question, like, did you think about, I'm going to pack my bags and I'm going to go back to Jordan. I'm going to find a job there. I mean, there's a great university there, and it's an American system, all of that. I mean, did you think about that? Did it cross your mind or?
It did. I still, at some point think about it, and I think about it in multiple ways. First of all, if I go there, could I find a job? And second thing, if I find a job, which I will probably find a job, is that job will make me, able to self-support my family, and be good to them. I don't know if you know, but there's many problems back in Jordan and other countries in the high rate of unemployment, even in physicians. I mean, not trained physicians in a way that you're, for example, oncologists, because there is really need for oncologists, but in general, there is a high rates of unemployment, and people who are there do not seem to be very happy, friends and so on. I think the system itself is not the system here. There is many struggles that patients go through. There is lack of insurance. People pay out of their pocket to get treated, so you're limited with what you offer. And God, for oncology, if you deal with this, it's very hard. It's very hard to tell a family that, your kid or you need such a treatment, but this treatment is expensive and you cannot, there is no insurance available to cover any of this. So yeah, I think there are issues related to self-satisfaction and even ability to do your job in a way that you really want to do it in a good way. I think you'll be limited to do that.
I think you alluded though to the pandemic also that just happened, and how this also does shape how you view things. So your mom was able to visit you despite the pandemic, but after your experience with your dad and the pandemic, which isolated people from each other, I mean, these thoughts cross the minds of immigrants all the time.
That's totally right. Now I think about it in a different way. I'm also limited with my wife, for example. She still need to clear her visa before we can go home. Otherwise, she will need to stay there for a while. I mean, she's done with training. She's a full pediatrics infectious disease attending now, and I'm done with training. So I don't think this is a problem for us because we're trained. You know, I hope the final training that we need to do, but I think there is many things to play with, and COVID probably complicated the whole story because. Even if you decide to go back, and now it's not as easy. Jobs, even in Jordan, there are not much jobs that are available for people to go to, and even if they're available, maybe not in the timeline that you need to do them. So
What's the feedback that you got on your piece, Samer? Did you get feedback from people you didn't know? I mean, obviously, I mean, we're meeting because it struck me, and I'm looking forward to a long life friendship with you. But did you get feedback from others and people you had no idea it existed?
I got many emails actually, and even many replies through Twitter, and even from my from friends that not are not in oncology, but they read it, and I mean most of them it was an emotional piece, and it brought some tears for many people, and also many shared that those are things that they went through themselves, and which make me even like. Kind of shocked in a way how frequent this could have happened, and there are people who shared with me that they were not lucky enough to even to spend a day or two with their family when that happened, and they didn't have the chance even to do that. So I mean, overall I got I think many feedback that from many folks, most of them are in medicine, sharing that they went through something like this, and I think that brings the whole discussion we were talking about, how much difficulties many people go through, especially immigrants, and especially people who are restricted on a way of how they deal with things.
Do you think you said you're a writer and you wrote in Arabic back in the day? I didn't know that you had a column. I would love to read some of your prior writings. Would love that. I'm trying to be a writer, except I'm a lousy one. But are you thinking of writing more along these lines? I'm not talking myeloma research trials. Are you thinking about writing something a little bit more for the normal genre or regular people?
Yeah, I mean, I do. I mean, I sometimes like put some pieces together and just keep it on my computer for future. And I think dealing with patients, especially with cancer patients, is really helpful in a way that it opens your eyes to many things. Difficulties that patients deal with. God, how some patients travel here just to get into a trial, or just get into therapy. It just shocked me how much people do to get treated, and how much support they get. So I think our job is keep this thinking of open, and ideas open, I mean, down the line, I think once I settle down more even in my job, and I would probably think about putting something together, which I was even thinking about it before, especially that I used to do that for years, especially in medical school, because I got good amount of columns there for years, and that you could have put them all together and even translate them. But this is something all in mind. I didn't go further and pursue it yet.
Well, you've got an avid reader for you if you ever take this to the next level. I think everyone who is listening should read that piece, and any future pieces you have. Samer, obviously, we talked about your journey as an immigrant physician, as a resident who got sick, and all of the emotional toll that you actually went through until you even were diagnosed and treated, and your hospitalization, and then the tragic, unfortunate, and untimely death of your dad. Anything else you want to share with listeners, and what would you want to tell them about you, the non-scientist, the human being?
Well, I think, and this could be something, even patients may not be aware of. I mean, we all are humans, and humans have issues and struggles in their life, and yet you may not know about it. And so, I mean, I think I even change now when I look at eyes of any person, any patient, any colleague, and any friend. I keep in my mind the fact that I may not know what they are going through, and I should be nice to everybody. And I think that this is what it takes. I think humans need to be nicer to each other and understand that they may be going through struggles or difficulties, and it does take less effort to be good to people than being bad to people. And I think if you're good to people, people will be good to you, and your life will be overall better. And I think our mission as physicians is to try to help people. And if we are honest with them and we're honest with ourselves, and keep an eye open around them, I think this will be for all our sake.
Well, despite how emotional this episode is, I really enjoyed talking to you and getting to meet you. And I look forward to seeing you in person. I believe we covered everything. And I just want to really thank you so much, Samer, for your time and for being with us. If there's last words are always to my guests. So you go with the last word.
Well, thank you so much, Shadi, for reaching out to me and inviting me to your wonderful podcast. I mean, it's an honor for me to be there and share this story with all of you. And I thank you for all the efforts you do on your previous podcast, which I personally listened to and learned from. And I think it's this is a space that is nice for people to share. And you really did a wonderful job with asking me all those questions. So thank you. And I thank everybody who's listening to us. And I'm sorry if that was emotional. And it just I think
you're the last person that needs to apologize for this.
I think many people probably went into struggles. And I feel I think I'm a better person after I personally have an illness that I'm dealing with, and also I went through this. I can relate to what it means to patients, I think, in a better way. I will probably never be 100% good with that, but I think I can do it in a better way now.
Dr. Samer Al-Hadidi, thank you so much for coming on Healthcare Unfiltered.
Thank you so much.